Croeso I Cyfarfod Blynyddol. ATIW. Have you all had that interpreted? That's a You're very welcome, everybody, and thank you for coming to our annual general meeting. We've got Maria Roberts, Assistant Director of Quality of Nursing, Health Professions, and in attendance today. We've got Craig Barker, our Assistant Director of Digital. We've got Charlotte Middlemas, our Deputy Director of Workforce Transformation, and Rebecca Bohr, our Associate Director of Workforce Transformation. We've got Zoe Gibson, our National Retention Lead, all in attendance, as well as the independent members and of course we've got Kirsty, Kirsty, who is our Dean of Dentistry. So the AGM has got a reasonable format, I hope. We'll have an overview from the Chief Executive, an overview from the Director of Finance, and then we will receive and hopefully approve the annual report. Then you have an opportunity as people joining us to put questions in the chat box, and I'm told I will be ably assisted by my colleague here to bring the questions forward, and we'll answer them. Following that part, which is the formal part of our AGM, there's a showcase, and today's showcase I think is really interesting. And for those of you who stayed for the long run, there's an opportunity again for you to put any questions you might have in the chat bar, and I will do my very best to get them considered and answered at the end of all of the presentations. So without further ado, it gives me great pleasure to invite our Chief Exec, Alec Howell, to give her overview.
Thank you, Chair. Diolch, Brendan Powell. So if we can just move on to the first slide. This just gives a very high-level overview of the key achievements that we have made progress on in 2024-25. So firstly, to start with the IMTP, we have delivered nearly 90% of the IMTP objectives for last year. And these range across many different and exciting areas, which I don't have much time to go into today. But nevertheless, I would like to take the opportunity to thank everybody that's helped us with those, because that includes obviously staff from across the organisation, but also many of our partners across the system as well, because they generally are very innovative, very strategic, and very forward-thinking areas of work. We have finalised now all of the strategic workforce plans that we've been working on. There are 8 in total. I will try and list them and test myself again. Nursing, perinatal, genomics, primary care, pharmacy, dental, diagnostics, and mental health. In many cases, these plans represent the first time that we've ever had a national approach to workforce planning in those professional or service areas. And that's really important in bringing together in a coherent way all of the important 7 themes from the workforce strategy to make sure that we are developing our workforce in a sustainable way, and not just treating this as a numbers game, because it's so much more than a numbers game, and it is very much around how we are valuing, supporting and treating our workforce as well. So those plans all came to their final stages in 2024-25, and so the focus now is very much on implementing those plans, because that was the whole point of developing them. We also achieved good fill rates for the majority of our educational training programmes last year. Some of these programmes we commissioned from our university partners, and some of these programmes are postgraduate programmes that we run in partnership with colleagues in health boards and trusts across Wales. Getting good fill rates was not necessarily an easy task, but again, I think that we've been able to demonstrate innovation and flexible thinking in order to look at new ways of securing recruitment into these programmes to make sure that that future pipeline for NHS Wales is as strong as possible. And that comes at the end of a number of years, really, of substantial growth in a number of those education and training programmes as well. We've continued to improve the quality and the range of the leadership programmes on offer in Wales. When we started in 2018, there were no specific NHS Wales national offers for leadership, and now we have over 10 new offers for our staff across Wales. And last year we added to these with the introduction of the new board induction programme, and continued to run some of the very successful programmes such as the Aspiring Chief Executive, the Aspiring Exec Director, and the Advanced Clinical Leadership programme. And we're also able to see now increasingly the impact of these programmes as we see people progress in their career pathways. We have worked hard on close working with a number of the national programmes to make sure that, as well as looking at the longer term, we are focused on delivering workforce solutions in the here and now and addressing some of those really critical workforce challenges that sit behind a number of those service areas. So, for example, we started a project last year on the perioperative workforce, which is clearly so critical to our planned care and cancer pathways. We also started a project on how we develop and support our cancer nurse specialists in Wales as well, again recognising the critical role that they play, as well as our work in primary care and mental health. We are going to talk a little bit later about the Always Retention programme. So just to say that we are really pleased that a programme that's been implemented in quite an innovative way, not using the usual top-down performance and programme management approaches, but very much embedding a communities of practice and QI approach, has really generated such enthusiasm and energy right across Wales. We were lucky at a recent board meeting to have a local and a national story about how that programme has developed, and so we'll pick up on that as we go through the meeting. But we are pretty confident that that has been a key factor in contributing to the improvement in turnover that we've seen in NHS Wales. We also ran the second national NHS Wales staff survey last year, and we have seen a slight improvement in response rates. But in particular, what we had was really positive feedback from colleagues in NHS organisations that the format and the content of the survey is now much more user-friendly, and so really puts in place strong foundations to really help us improve those response rates as we launch the survey for the next round, which is on the 6th of October. And as colleagues will remember, NHS England have been running this survey for many, many years, and as a result have got really rich and longitudinal data on staff experience, and the NHS Wales staff survey is going to give us that in Wales, which will really inform not just local work, but the work of national bodies such as ourselves. And finally, just to note the increased quality and accessibility of workforce data, which Craig will be coming on to later on, through our data and analytics portal and supported by 12 workforce dashboards, which not only provide better data for us as the national workforce body, but also available for other NHS organisations to do their local planning. So a huge range of achievements during 2024-25, and again, just to reiterate, our thanks to everybody who's contributed to that, whether that's our HEIW colleagues or our partners across the organisation. And if we move on to the next slide, on that note, just to really reinforce that point about not being able to really make progress on our own, we have to do it with our partners and our stakeholders. And in particular, just last year to highlight a few areas, we had a number of really productive meetings and open mornings with our Welsh Government and NHS executive colleagues, recognising the new NHS executive, which is now called NHS Performance and Improvement, was another national body, and therefore we needed to develop good working relationships to ensure that on those national workforce issues there is clarity about direction and best use of scarce workforce resources. We also have done some much closer working with Public Health Wales, and in our IMTP for this year we have a joint objective on workforce wellbeing and how we embed prevention skills in our workforce. We continue to have really close relationships with our colleagues across the UK, recognising that much of what we do is in that UK context, particularly when it comes to education and training. And so relationships, particularly at chief executive level and medical director level, are really important there, despite the fact that there are numbers of changes going on across the UK in terms of structures that could potentially impact on those relationships. So it's been even more important than ever that we maintain that close working. And then finally, just to mention our stakeholder reference group, which continues to be a really source of advice. It really encourages us to be open, transparent, and be open to scrutiny really and questions from colleagues in partner organisations and stakeholder organisations on all of the new pieces of work that we are developing in HEO. So we're really grateful for their participation in that. And then if we move on to the next slide. Although 2024-25 was really a positive year, there were clearly some issues and risks to deal with. I can see there's a typo at the top of this slide, so I do apologise. And so these are some of the things that we were dealing with in order to get to that positive outcome. So one of the things that did affect some of our delivery last year was a change in planning approach at Welsh Government level and the introduction of a remit letter and some changes to the national allocation process. So that didn't affect any of the work that we did last year, but certainly affected how we developed our IMTP for this coming year. We also saw some pressures around some of the UK processes around postgraduate medical education. So, for example, foundation doctor oversubscription from the summer of 2024 clearly created a lot of concern for some of our foundation doctors, a lot of concern for some of our organisations, and a lot of work for our colleagues in the medical deanery and HEOW, which ultimately was resolved in a positive outcome in that we actually had fewer vacancies in our foundation doctor rotas than we previously had, but clearly there was an impact on people as part of that process, which obviously we learned from. We have seen some fragility with our higher education institutions over the last year, and the Cardiff University consultation on this nursing programme is a case in point, and obviously that did create a lot of work for us in responding to how we would deal with a potential reduction in the capacity to train our future nursing workforce. And then we've probably had now around 18 months of challenges and turbulence really in relation to our medical associate practitioners, particularly our physicians associates, and the introduction or the announcement of the Leng review in the middle of 2024, which really has given us all sorts of challenges in respect of our students who are wanting to become physicians associates, but also our students who are graduating and are looking for jobs, as well as then our physicians associates within the workforce. So again, that has been quite a large piece of work to manage and continues as we speak, because obviously there are still outstanding issues to do with the Leng review. And then finally, just to touch on digital transformation, which in general has been a very, very positive story for HEOW when we look at some of the digital platforms that are, working really well and having such a lot of traffic through them, like Dusky, our learning management system, our Gwetga portal. But we did see some initial teething problems with our Coddy platform, which is how we're going to really improve the management of our resident doctor and trainee experience in future years. So that was something which did affect our delivery in the last quarter of 2024-25. But then looking ahead to 25-26, the year that we're currently in, obviously the focus for us is on implementing the integrated medium-term plan, which has been accepted by Welsh Government, and also implementing the education and training plan for this year, which was approved by Welsh Government back in January of this year. We also have just submitted our education and training plan for 26-27. But obviously what's happened since we gave in our IMTP is that the Cabinet Secretary has issued a set of priorities really for the run up to the Senedd election next year, called Improving Performance Together. And so we are really focusing on some of these areas as a lens for our IMTP. So these focus an awful lot on workforce solutions that support NHS delivery. So I've mentioned already some of the work we're doing that's closely aligned with planned care, counsel and diagnostics. Continuing to really spread and expand our leadership and management development, with a particular focus on our operational managers, who play such a vital and important role in the delivery of our services right at the front line, working alongside clinicians and really being the sort of point where all of the financial quality, performance, workforce expectations land. And those jobs are really, really challenging jobs. And for many years, at an always level, we haven't given those people the right level of support to make sure that they are valued and that they can do the best work that they can possibly do. So that is a key priority for us this year. We're also really pleased to see the focus on primary community services and the refreshed focus, which is called Delivering Integrated Health Services in the Community. And as an organisation, we do feel that we've put in place some really sound foundations for this work through the development of our primary care academies, through the strategic workforce plan for primary care, but also through the ongoing work that's done to support our contractor professions, whether that's our dental workforce, our optometry workforce, and the increase in GP training that we've seen, and our pharmacy colleagues as well. So we do really feel that we've got a really good story to use there to really support that agenda going forward. And then last but not least is supporting, how we really equip our workforce to really be effective and productive in a digital environment. And that means supporting the digital skills of the workforce, supporting their digital capability, but also increasingly planning our workforce around the opportunity that digital brings to service delivery, so that we take an integrated approach to workforce planning and digital service planning going forward. And again, you've got really good foundations to build on there through the work that's been done already on the digital capability framework, the landscape review on AI, and other areas of work that HIW is driving forward. So that's a bit of a flavour of the year that we're currently in. So we look forward to reporting on all of that work at the end of the year. And I will hand back to the chairman.
Thank you, Alex. Thank you for that report. I've misled you all. If you have a question you want to ask, can you put it in the Q&A bar, not in the chat box? I do apologise. I was bound to get it wrong. So let's hand over now to Lynn, who will give the Director of Finance overview for 24-25.
Diolch, Gadeirydd. Thank you, Chair. Good afternoon, everybody. I'm going to present a very brief overview of the 24-25 financial year. I'd also like to take this opportunity to thank a few people as well, our auditors, the board, audit and assurance committee members, to our staff and partners, who all play an important part, I think, in how we make sure we make the best use of our financial resources in delivering our priorities. So I want to sort of recognise all of those people in that respect. In terms of this slide, you can see here, HIW as a special health authority has two statutory financial targets. One is to live within its revenue budget, which was a budget of just over 350 million last year. And the other one is to live within its capital budget. And we had a budget of about 2.2 million last year, primarily related to capital projects on IT and digital. You'll see that in terms of last year, we achieved a surplus on against both of these budgets, so effectively meeting our statutory financial targets, which is obviously very pleasing. We also have a third sort of administrative target. It's not necessarily a statutory target, But it is a really important target in terms of making sure that we pay our suppliers on a timely basis. Many of our suppliers are small businesses. They're an important part of the local communities. So again, the part that we play in making sure that we pay our invoices on time is really important in doing that as a large public sector organisation. And you'll see we have a target of 95%. So we have to pay, well, the target requires us to pay our non-NHS suppliers within 30 days usually. And you'll see that in terms of last year, we exceeded that target. So again, it's pleasing to be able to report that. If we can move on to the next slide, please. So this chart just really gives you a very high level view of how we spend our money. It's broken down between three broad areas. One, the largest part is marked up as commissioning, and this is effectively the money that we spend on commissioning, education and training. As you can see, it's the largest part of what we spend our money on. Between 23/4 and last year, we increased our spend here by about 11%. This primarily relates to, as I say, education training, so we're training more doctors, nurses and other healthcare professionals, whether that be in terms of undergraduate or postgraduate. And again, it just gives you a feel for the increase that we see there. It also includes things like costs of providing things like a bursary for students as well. So that's also reflected in that increased spend. The smaller parts of the graph then relate to what we call non-pay and pay, and there's a range of things that we spend money on within here, which I won't go into in detail, but so some of the things where we spend money on leadership programs, for instance, will be captured in our non-pay spend. So again, you can see that there was an increase in some of the spend there, and that relates to where we're doing more in terms of developing the workforce across NHS Wales. It also obviously picks up any inflationary pressures that HIW has to absorb, as with any other organisation. And then the third area is around pay. This is not just around the staff that are employed by HIW, but also where we commission training, which means we've got trainees who receive salaries whilst they're undertaking training. So obvious examples would be resident doctors, medical training, and of course the pay increase in spend includes things like the increased pay award that was made last year as well. So if we move on to the final slide, please. Thank you very much. And again, I'm not expecting people to be able to see all of the detail in here, but I guess what I wanted to the point I wanted to make here really is our funding. We have enjoyed a sort of growth in funding over the last few years, although I think it's fair to say if you take out the impact of inflationary pressures that started to plateau in the last couple of years. The important thing is what we do with that funding. So the value that we deliver as an organisation and through the education training that we commission and the impact that it has. And increasingly, we are measuring and looking at the data that we collect to be able to demonstrate the impact that investing in education training in the NHS workforce has. So this slide just gives a few examples of things like the return on investment that we get if we invest in a nurse graduate or in some of our specialty training doctors. And again, I think demonstrates a really good payback on the investment that NHS Wales gets as a result of that. There are also some dashboards there that you'll see. There's quite a lot of detail on them, but it demonstrates that increasingly we're looking more at not just how many people we're training, but actually how many people end up going into the NHS in Wales to work. and how we work with NHS partners to make sure that there are jobs available for people to move into. So our use of data is increasingly important in making sure that the money we spend on investment in education and training results in people working in the NHS in Wales. I think this is particularly important given the financial environment that we face in the NHS Wales and the wider public sector, which I think just demonstrate that making the right investment in education and training of our workforce is probably more important than ever. So that's what I really wanted to cover. Hopefully people find that helpful. Diolch yn fawr. Thank you very much, and I'll hand back to the chair.
Thank you, Glenn. It's now time to receive and approve the annual report. Are you presenting this, Alex?
Yes. I'm presenting the annual report.
Oh, yes.
I think it's a bit earlier on, and I would like to go to.
So I'm sure members would be happy to approve this annual report.
Yes.
Yes, thank you very much. The next part of the agenda is really what it's all about, and that's to receive and approve the annual quality report. So I think I've got Lisa and Maria.
Diolch yn fawr at y cadeirydd a Jeff prynhawn da pawb. Everybody actually knows that the duty of quality came into effect actually in April 2023, and how important that means actually, and it applies to all NHS organisations, and it is important actually in terms of actually how that actually improves care and service provision to our Welsh population. So we've got a legal responsibility to improve actually the quality of services in HIW as well as actually into the system as well. And we continue to embed that duty of quality across the work that we undertake and deliver. So improving quality is everybody's business. And I'm pleased to say that during 24-25, HIW has made a good progress in embedding the duty of quality across all the aspects of our work. And in order to sort of actually demonstrate that, I'd like to hand over to Maria, who will actually give us actually a flavour of actually how we've achieved that and the ongoing work that all of our teams actually across the HIW is doing in order to deliver that. So, diolch yn fawr to Maria.
Thank you. The statutory duty of quality then requires us to prepare an annual quality report, and we're pleased to share this second quality report with you today. The report provides an overview of HIW with our role, functions, and our approach to quality set out. It focuses on our progress over the previous year, and it highlights the feedback that we've received from various people, including people like Audit Wales. We celebrate the many successes of our colleagues who have been recognised with awards and who have influenced and contributed to national programmes of work. But it provides us with an opportunity to reflect not only on what has gone well, but to ask ourselves, how can we learn and improve? To that end, the report describes several key areas for us to focus on in our quality improvement journey. And some examples to highlight include that we will continue to embed the 4 key components of the duty of quality, with the health and care quality standards firmly positioned as our quality lens. We will progress our ambition to hear the voice of our learners as part of our quality assurance but improvement processes. We will participate in the National Safe Care Partnership Programme that is being coordinated by our colleagues in NHS Performance and Improvements. This supports us with strengthening our quality management system, but also promotes our contribution within the NHS Wales quality community. We will continue to mature our quality reporting processes with integration with planning and performance where appropriate. We hope that you enjoy reading our annual quality report and that you find it an interesting and informative document.
Thank you. So I'm asking the board to receive and approve the annual qualities report? Yes?
Yes.
Thank you very much. Well, that brings us to the end of the very formal part of an annual general meeting, apart from responding to any questions that you might want to ask. And thus far, I have had one question, and it looks as if it's heading your way, Lisa, so heads up. How do we get specialist education for emergency nursing added into the ETP and IMTP for Wales, please? Hoping this will start to address how we plan to meet the suggested national education standards for emergency nurses in the UK.
A really important question and a very welcome question. So just to explain how do we develop expertise in the nursing profession, and HIW is involved on a national programme in terms of urgent care. So hopefully this work will come through that arena. But as well as that, the key part to getting into our education and training plan is we work with our NHS partners in health boards and trusts to understand what their service needs are, and how we can help to enhance this as well. But as well as that, obviously we have a strategic nursing workforce plan, which is exploring all the developments that we need to undertake to understand what the needs are out there as well. So there are a number of avenues that we can take to take this forward. Primarily, the national programme is a key driver, which we're engaged in. The other one is the involvement and the influence through our IMTP from the NHS system, and then we will look at it from our strategic nursing workforce plan too. I'll have the detail in front of me, but those are the mechanisms that we've got in place to look at this.
I invite who's asked that question to get in touch with Lisa directly if you want more detail. Thank you for that question. I haven't had any other questions. No? In that case, then I'll bring this first part of the agenda to a close. But I do want to say a couple of things. I hope you've seen the breadth and depth of the work that the organisation does. I have to say thank you to my independent members for their incorrigible energy and interest and their ability to quiz and query, as well as help direct strategy. And Alex, I need to say to you very directly and the executive team, thank you for your tenacity, dedication, energy, and your expertise. But above all, I want to say diolch o galon to all our staff, all the people who contribute their elements of the work, people who work from this building, and all those people involved directly with clinical education and training out there. Our partner organisations, you've been through them, but really our job is to make other people look good. And my ambition is that this organisation is amongst the best partners money can buy. Now, this year has seen a couple of sad things as well. So I would like to say at this AGM, a big thank you to Helen Walker, Ruth Walker, who passed away, who was a member of our team here. And I'd also like to pay our respects to the family of Tina Donnelly, who was an independent member here and served us well with a good heart and the NHS and Wales. So with that, I'd like us to move on to the next bit, which is the uplifting bit, I hope. We're going to go into my favourite thing, which is the brag. This is the showcase bit of an AGM. And, you know, it's been constructed. So actually it's in three parts. It's been constructed so it actually makes sense. and it's a bit of a journey, so you have to bear with it a bit. Our task is to develop the workforce that's there today, to look into the future, and to develop the workforce for the future, but also develop the people who are in the workforce today for the future. So it's a bit of a Donald Rumsfeld, really. It's preparing for the unknown knowns. And we are very fortunate to live in an age where technology and digital is driving clinical outcomes to a much better place. The possibilities are much greater, and our abilities to communicate with the population are much greater. But we need to work with the workforce that's there today and prepare the people coming into the workforce to be able to cope with a change which is seismic, really. So what we're going to do as a national body, we're going to try and demonstrate first how our growing data and analytics capability is transforming workforce understanding. By providing timely, actionable insights, our data teams give leaders across the NHS Wales the intelligence they need to make informed decisions. And I think informed decisions is the active bit in there. Secondly, we're going to how these insights then shape national workforce plans. With partners, we've produced 8 workforce plans, as Alex described, but today we'll focus on our strategic nursing workforce plan that was launched in March. And these aren't just documents, they are roadmaps to grow, transform, and support our workforce. And that means better care closer to home for our people. And finally, we've got this. Now we've gone to all that bother of training people, and people have gained experience of working. How do we retain them? So the National Retention Programme, which recognises that recruitment is not enough. One thing will not eat this elephant. So to sustain the workforce, colleagues must feel valued, supported, inspired to stay and thrive in NHS Wales. Who wouldn't want that to happen? So that retention story will play out. So what connects these elements is a simple idea. Better data leads to better planning, and better planning builds stronger, more resilient teams. So today you'll hear about progress, achievements and impact so far. So let's begin with the data, and I was going to change the order, but I thought no, stick to the script. So we're going to start off with the data and analytics team and how it's laying the foundations for smarter, more sustainable NHS workforce. So Craig, Ryan, don't let me down.
Thank you, Chris.
No pressure.
So, Prynawn da pawb, good afternoon. It's a privilege to be here actually to talk about data and how data is making a difference. I think Chris is completely right. To quote Edward Deming, without data, you're just another person with an opinion. So we need good data, we need evidence-based data to drive improvement and to understand what's happened and understand what will happen potentially. So there's exciting stuff that Ryan will be talking about in terms of our ability to model and do data modeling going forward. It's always worthwhile mentioning that we have got a digital and data strategy, and mission 4 you'll see there is around data and as being able to provide intelligence. We're in a second year of the strategy, still working towards it. We've made massive inroads and progress, which will hopefully be evident through the rest of the presentation. So we go on to the next slide. So in terms of how we're approaching this, we're very much about an ecosystem things and not just technology, because technology is there to underpin. There's also important things there in terms of how we structure, how we link things together, and how we ensure we've got the right stakeholders and community of practice in there. So the approach that we're taking is to build a centre for workforce intelligence and planning. This is somewhat similar to the our colleagues in Scotland in MES, but we're actually going to be doing that a little bit better. So in terms of the elements that we've got there, we've got a data analytics portal, which I'll be briefly showcasing. We have the capacity and ability to do workforce modelling in, and we're strengthening that. The more data becomes available and the better the quality, the more we're able to do, because there's still the elements of garbage in, garbage out there. In terms of getting that information out there, we also have a workforce planning hub that we're working on with our workforce planning team. And there's also a workforce observatory for external stakeholders to gather and find information as well. And I've already sort of alluded to the community of practices. So not just technology. Technology is underpinning things, but actually it's more than just the technology, which is great for me from someone who's from digital. Next slide, please. So in terms of what we've created, so I've mentioned the data analytics portal. Within that data analytics portal, which is accessible to NHS staff across Wales, but also to colleagues in Welsh Government, we're actually using the products hosted within that dashboard. So as Alex alluded to earlier, we've got 12 dashboards in there. I think, Glyn, when you were presenting some of the dashboards earlier, some of those were the existing dashboards that we've got as well. Have been very well received in the academic and in also the health boards. I think some of the ones that you showed there, Glyn, are being looked at by workforce and OD directors, as well as directors of finance, etc. So certainly something that people are starting to use and embrace in terms of making evidence-based decisions. In addition to those, it's also worth mentioning that we also have dashboards around our secondary care workforce. So we're able to understand the makeup, the demographics, the participation rates, whole-time equivalents, a lot of things you'd expect us to be able to understand. Nationally, we go back 10 years in terms of being able to produce that data. We're also now building similar things for primary care. I guess one of the bits that we'll go on to a little bit later is tell a bit of a story in terms of how we can look at GMS data in primary care, GP data, and understand that journey from awareness to retirement by linking data. So that is a novel approach. We are 4 nations leading in that space in terms of capability and being able to do that. So just if we go on to the next slide. So in terms of some take homes, so it's sort of, everyone will sort of understand this, but without data, we're not able to make informed decisions. We've said that, but it shows us where we are now. Data allows us to understand and forecast, and we'll have an example of that in a second, what the future might look like, and that's based on scenario generation. It also allows us to understand if we're making a difference, if we are making those inroads, the impact piece, the quality piece. And I guess there's the bit around, it's a cyclical thing where we just need to be improving our data ability and functionality to be able to answer the questions as they're posed to us. So go hand over to Ryan to just talk a little bit in terms of the GP training pipeline, because that tells a little bit of a story rather than just talking about the overall thing.
Yeah, so as Craig has sort of alluded to, we've been able to link various different data sets together to begin start to tell a story. We've done this for the GP workforce, but obviously we're looking to do this across the board. And given that our biggest sort of part of the budget is around our training pipeline, this is a really important piece for us. So this sort of tells the story of how many students we've got in at any point in time, and then what's happened to them, and then what's happened to them straight after training, and then what has happened to them now. And this is really powerful stuff because it helps us answer some, or at least investigate some of the questions around why do certain cohorts take longer to go through the system? Why are some people staying? Why are some people leaving? So that helps us sort of start to pose those questions. And then we can start to put in interventions. And because we have the data, we're then able to assess, how impactful those interventions were. And then that's what I think leading back to what Glyn was talking about was, if we know how many we've trained, where they've landed, and what they're doing now, then we're actually able to start to do a bit of an ROI, so return on investment of our trainees. So lots of really good work going on in this area. So this slide is our predictive analytics piece, and this is looking at supply and demand. So if you just look at the graph, the top line is our demand, and then our bottom line is supply, and that is just looking at, if we were to just roll on what's currently happening, this is what we think the future would look like. So you can see the supply and demand sort of beginning to move apart. But what is really useful in doing this sort of supply and demand modeling is the scenarios that we can run. So we've used this work for the strategic nursing workforce plan, and in there, so the second line we said of retention, we've sort of explored what would the impact be of increasing our retention rates. This isn't saying this is exactly what's going to happen, but what it does show is that retention has a massive impact on moving that supply line towards the demand line. And ultimately, what we want to do is move those two lines together so supply meets demand. And then the other thing that you can draw out of this, which I think is really interesting, is we've got a couple of scenarios around education commissioning and training practices. And you can see from here that if you were to make a change today, you don't see the impact until 3 years, 4 years because of the lag. And that is why supply and demand modeling, I think, is really important, because it helps us forecast and understand lags in the system, and it will help us to better understand the boom and bust nature of training. So we go through cycles of we have lots of nurses, and then we go through cycles of we don't have enough nurses. And being able to forecast this in the future helps us as a commissioning body better plan for the future. I think it's probably just worth saying that this modelling has galvanised, I would say, the local teams, because what they want is they want to be able to do this locally. So that has then resulted in a community practice to understand how workforce modelling can be done locally, which then leads back to us and our local teams making informed decisions based on data.
And final slide on me. So we've discussed some of the elements in the Centre for Workforce Intelligence and Planning, and that is a joint IMTP deliverable this year between data analytics and the planning team. I think fostering that working relationship and making sure we're integrated is definitely the way forward. We are doing quite a lot in terms of those community practices and groups and posing questions. We've done quite a bit of other things in terms of engagement. The slide says that we had 28,000 dashboard views, which is great, and we have. The Workforce Planning Hub has had many hits as well. But that's only part of the engagement and reach story. We've also been doing workshops with health board colleagues, with workforce and digital teams, to actually understand their capabilities, what their questions are, and how we can work more seamlessly together, and also championing the elements of data quality and how we can improve that. Because if we're honest, data quality with workforce data isn't actually quite up to the standard of clinical data. But that's something that we just need to work on and address, and we are working with partners to do that. So that's amazing stuff in this space. In terms of training, we've done plenty of training, and we're working towards doing more. There is a resource not only on the Workforce Planning Hub, where you can see there's the enrolled members there for workforce planning training. We've also been doing some stuff around data literacy as well, because if people in organisations are not data literate, how are they going to be able to make informed decisions on the data that we present in front of them? We've covered the data modelling and insight. I guess this bit around the national impact and credibility might require a slight or just a bit of a footnote. So we do publish and will be shortly publishing again the National Workforce Trends document, which is seen as the de facto NHS workforce report for Wales. We've been doing that since the inception of actually before HIW. And that's always been really well received, but we're still strengthening that. So some of the things that we talked about today in terms of being able to link data, tell a story, understand what the future is, and look at what the past has been, and have those conversations will no doubt be bolstered and improved in the future. And we're certainly working towards that. And final thing to say, because I wouldn't have mentioned artificial intelligence in the call otherwise, and I like to do that, is that we're also exploring how artificial intelligence can help us with the modelling and the data quality, but also with the upskilling and the training as well.
Okay, thank you. You can tell how enthusiastic you are about your data and your information.
Do you want to give your presentation now?
Sorry?
I was going to say thank you to Craig.
Oh, I beg your pardon.
Yes.
Yeah.
I was okay. I'll make it easy. Thank you, Craig. Thank you, Ryan. No pressure, Rebecca and Michelle.
Thank you. I'm just going to provide some context to what is the first strategic nursing workforce plan produced here in NHS Wales, and then my colleague Rebecca will talk in more detail about the plan. The nursing workforce is the largest profession in the NHS, and in Wales it makes up 40% of the total workforce. And in recent years, and particularly since the pandemic, the nursing profession has faced significant challenges in recruitment, retention, but also alongside, the significant demographic changes that we're seeing, for example, associated with an ageing population and the ever-increasing demand for healthcare. Registered nurses, of course, work as part of multidisciplinary teams, but they're also often the first healthcare professional that a patient sees, and many times are the only professionals. And nurses are consistently ranked amongst the most trusted professionals. Our registered nurses are decision makers who use evidence-based knowledge to support their practice. And that practice is based on what we call the 4 pillars, that of clinical, academic, research, and leadership, delivering care across a wide spectrum of services and specialties that include emergency, primary care, community care, public health, health promotion, and the independent sector. So in the plan, we've adopted the Royal College of Nurses definition of nursing. And an extract from that states that nursing is a safety critical profession, and the vigilance of nurses is critical to the safety of patients and to the prevention of avoidable harm, regardless of the location of care or the situation. So this plan is aimed at addressing the significant challenges facing the nursing workforce. And we believe it provides a foundation and a real opportunity to change, and more importantly, to bring about improvement to the care of patients and populations, and also to support the sustainability and the well-being of our nursing workforce. And I'll hand over to Rebecca now, who will give us more detail.
Thank you very much. Thank you. So a core strength of this plan is in its foundation in robust triangulated data. And we developed the plan using HIW's 3-pillar approach, which you can see there. So we drew on a wide range of quantitative data, so things like workforce numbers, student fill rates, retention trends, age profiles, and combined this with qualitative insights from our horizon scanning, and really importantly, from our engagement with stakeholders, but from the workforce themselves, from nurses across Wales. So as Ryan has said, this is the first workforce plan to use supply and demand modelling to forecast future needs. while also engaging nurses, educators and employers to reflect the reality of the workforce challenges. So it's important that those two things go together. We also incorporated population health data and future service needs to ensure the plan addresses not just the current pressures, but the long-term system requirements and change. Last week, I was talking to a colleague from England, actually, and we were having a discussion, and he said to me, the currency of good decision-making is information, which is kind of the theme of today, really. So he was talking about emergency medicine and teamwork, but it resonates here too. So the plan is based on that good data, which ultimately leads to better decisions. But also essential to that is effective team working, because that enables the sharing of information. And I think for me, one of the great things about working in HIW is the way that we do collaborate or matrix work. We work together, and I'll talk a little bit more about some of those joint pieces of work as I talk a little bit more about the plan. So that early data collection, that horizon scanning and engagement helped us to shape the plan's 3 strategic themes. So that is focusing on growing, transforming and supporting the nursing workforce. And I'll just go on to provide a flavour of some of the projects and programmes of work that we're currently focused on. So when we think about growing the workforce, so here we work closely with our education and commissioning colleagues, our future workforce colleagues, to take this work forward. The plan supports expanded routes into nursing with rising interest in part-time, flexible, distance learning pathways, which is essential for attracting a multi-generational workforce and widening access into the profession. There's a strong focus on placement expansion in primary and community care, aligned with the strategic goal of delivering care closer to home, alongside a focus on rurality. So we don't just want placements in urban areas with big hospitals and areas of multiple deprivation, developing knowledge and understanding of local communities and population needs, and that broader definition of health, those wider determinants of health, and integrated working across social care in the third sector. Colleagues in data and analytics help develop a dashboard which allows us to monitor placement capacity and growth across Wales. And then also things like UCAS data and fill rates allow us to track recruitment trends and tailor our attraction strategies. The future workforce team have planned a Get Into Nursing webinar, I think it's next month, which we will be supporting along with the Chief Nursing Officer, who will also be in attendance. And all schools and colleges from across Wales will be invited to attend that. Moving on to transforming. So transformation is vital to meet evolving needs and embrace innovation in areas such as research, evidence and service improvement, but also genomics, digital health and technology, but also supporting that shift to community and expansion in public health. So we've established a community oversight group to drive actions related to primary and community care. And last week we facilitated a national workshop, bringing together nurses from across Wales to inform our approach and support that shift to community-based care. And just to mention as well, the breadth of nursing that work in the community. So from health visiting, school nursing, district nursing, mental health, children's community nursing, there are so many disciplines, if you like, that work in that community-based care arena. On to the next slide. So in terms of supporting our workforce, so it isn't just about numbers, although they are important. It's really important that we support the nursing workforce. So retention is a key focus, with actions to promote wellbeing, flexible career pathways, structured development routes. The team have recently completed and will soon be launching the Nursing Career Framework and Career Pathway, offering progression from support roles to consultant level practice, helping retain experienced staff and nurture talent. And the next one. So in terms of impact and achievements, so we are just 6 months into implementation, but progress is already visible. So just to mention a few things, we've worked with our education and commissioning colleagues to expand postgraduate commissioning in areas such as advanced practice, enhanced maternity care, learning disability, mental health nursing, general practice nursing, occupational health nursing. We've worked with our colleagues in the leadership team to develop and deliver a train-the-trainer workshop based on the work of Professor Michael West, focused on high-performing teams. We've delivered this to over 400 nurses and midwives from across Wales. To date, we've received 270 evaluations for the workshop with an average rating of 4.73 out of 5. And we're now exploring how we measure the medium and longer term impacts of this using the Kirkpatrick methodology, which focuses on the 4 levels of reaction, learning, behaviour and results. We've also developed e-learning and an interactive workshop on motivational interviewing, and that will be published on a T-Dysgu next month. So this is an approach to behaviour change. So we've worked with our colleagues in Public Health Wales as we've developed this work, and in fact it will complement their MEC training, and we'll have the links to link to both areas of work. We've just published e-learning focused on physical activity in preschool children for those working in the early years. We've completed a literature review on the virtual nurse role and tele-sitting, including the cost benefits of these roles, and we'll be presenting that to our nursing workforce plan implementation group for further discussion and the next steps. And we've also linked in with colleagues in the southwest of England who are piloting these roles. We've published our first newsletter to support ongoing engagement with the nursing workforce. So hopefully what you can see from this is that data is a golden thread throughout our work. This data-driven approach helps us to make workforce planning more consistent and future-proof across NHS Wales, and it helps us to monitor trends and improvements, allowing us as HIW to be responsive and to evaluate the impact of our work. And just to mention, one of the early outputs of the plan was a nurse retention planning guide. So I'm going to hand back seamlessly to the chair. Diolch yn fawr.
Thank you. You already planned that. Right. Thank you ever so much, both of you. Zoe.
Very much, Blynyddol. And it's absolutely amazing to be here to shine a beacon of attention across NHS Wales. So as colleagues have alluded to, we have been focusing on nurse retention, but it's just to highlight that the National Retention Programme is interprofessional. So it is for all staff across NHS Wales, although we have had significant focus within nursing. So to start off and explain a bit about the challenge of retention, it's, as with all the other workforce challenges that we face, it is a global situation. It's not something just isolated within Wales or organisations within NHS Wales. But as colleagues have alluded to, it is key to improve retention to overcome the challenges that we face to ensure the availability of the skilled and sustainable workforce to deliver the care and services that the population of Wales deserve. As we've said with several other aspects, retention is more than about numbers, it's more than rates, and it's more than sort of data points. This is about people, it's about professions, and it's about staff that want to give the best they possibly can for the care of patients. Retention is within the evidence associated with improved quality and safety of care and services, and also importantly productivity, all of which are challenges that we face on a daily basis, and we all work together to ensure maximum output is achieved. So what can we do to improve retention? Unfortunately, there's not a quick, easy fix. Improving retention requires significant cultural change, and it needs us to develop and embed cultures that support our colleagues across NHS Wales to feel a sense of belonging, to have an opportunity to thrive, and ultimately NHS Wales being an employer where staff choose to stay. This isn't about making staff stay, it's about changing our environment so that they choose to stay. But as with all cultural change, it isn't easy, and what it requires is everyone across the system to play their part. So how have we in HIW responded? I think the major headline for this is we didn't respond alone. So we've taken an approach which is focusing on national leadership, yet local delivery. So the programme's established and led by myself and HIW in December 2023. And from that, we've managed to establish the programme delivery model, which is largely focused on the development and sustainability of a community of practice. So that community of practice consists of 11 retention leads that have been employed as part of this programme, who operate at a local level within organisations across NHS Wales. And we come together as a team to support system-wide, collective, collaborative, inventory approaches where we learn together, celebrate success together, and sometimes try and come over the wicked problems of retention together and share best practice. The other foundation of the programme is that compassionate leadership, cultures and supported workplaces. So that is where that sense of belonging, that ability to thrive and that choice to stay is actually key. But in order to achieve all of this, data has actually been key. When we started the programme, retention positions and challenges across NHS Wales weren't clear. There'd already been a lot of good work being undertaken to try and improve retention, but it was almost based on a wish lists and areas of interest. So what we've been able to do through the programme, through utilising the data approaches that have been described by colleagues, is to develop a range of triangulated metrics, dashboards and self-assessment tools that have enabled organisations and ourselves in HIW to identify both national and local retention challenges, which then enable us to provide this data-driven and prioritised approach. So we've been able to concentrate on the areas of greatest impact, both at a local and a national level. I think that's probably one of the anomalies with retention, isn't always well understood. As a system, we don't face one retention challenge. It's multifaceted, it's complex, and it varies through geography, demographics, organisational culture. So no organisation in Wales has the same challenge to face. And what we've been able to do through all of these aspects is to work together collectively, collaboratively, to improve retention, also to spread and scale good practice, rather than all organisations focus on one aspect of retention improvement. It has demonstrated an efficient approach. So what have been our key achievements? Particularly the community practice and the members of that. I think sometimes we feel perhaps it's a happy accident, but I think it's due to the fact that we have 11 extremely dedicated and skilled individuals who've got a real passion to improve the landscape for staff across NHS Wales. The community practice has been sustained for 18 months now, and our levels of engagement and attendance remain really high. With each face-to-face meeting every 6 weeks, having over 95% attendance rates there. It's our collective and collaborative approaches. Again, strength to the community and practices. Every organisation across Wales have worked together. We're very transparent and we're very collaborative. You know, we acknowledge that no one is perfect and everywhere can improve, but it is that open dialogue and that open transparency with data and other sources of information that have helped us push forward. Also key have been the digital team in HIW have helped us develop a range of metrics, dashboards and data-driven approaches that have made this a reality, as have the development of continuous quality improvement approaches, with full acknowledgement that not all improvement works and that learning is key. So I think our approach has helped us to find out also what doesn't impact retention positively and to move on to the things that have greater impact. We've also developed a digital retention hub within the Blynyddol platform to help us celebrate and spread retention good practice to colleagues across NHS Wales. And really proudly, we've now also been nominated and recognised as finalists within the Nursing Times Workforce Team of the Year awards. So we'll be travelling to London shortly to give our presentations. But that acknowledgement in itself, I think, has raised the profile of retention improvement and also the impact NHS Wales can make. So that is great. Please. So what has the impact been? Because it's all great if we're shiny and it looks great, but we are seeing positive impacts on retention. As I said at the start, this is culture change. It takes time, so it doesn't happen overnight, but we are seeing reductions in the numbers of staff leaving across professions in NHS Wales. We're also seeing reported trends in voluntary resignations being in a downward nature, and that is across organisations in Wales from their data. We've got stable organisational movement, so we've got a healthy mix of staff moving between organisations, which keeps the workforce engaged and motivated, but we're not seeing a sort of hemorrhaging situation from any particular organisations. And importantly, we're retaining knowledge, skill and expertise with the workforce that we have. And going back to several of the presentations today, there is a financial benefit to this, which although is not my greatest motivator as in this, and has been about improving the environments in which we work. there is considerable cost avoidance savings associated with reduced temporary staffing costs, continuous onboarding, and also the lost training costs when staff choose to leave NHS Wales. They take with them their training, their knowledge and their expertise. And all of this together makes the biggest impact on improving the quality of care and services that we provide, and also optimising productivity to ensure that, going back to the quality aspect, that our patients and services population in Wales receive high quality services. So this is a bit of a slide that I've put in because, as I said at the start, this is more than numbers, it's about people. So these are a couple of photos and case studies of colleagues across NHS Wales who have been positively impacted through the changes in working environments and approaches. And I'd just like to finish off with a very quick staff story, particularly relating to flexible working and the positive impact that it's made.
As a nurse, I am a parent carer to my son, Riley, who has had ischemic strokes and also has a really rare arterial disease of the brain called moyamoya. The challenges for me were trying to split myself really, attending the multiple hospital appointments that come with, supporting somebody with an underlying condition, and fulfilling my role. I found that quite challenging because I felt quite torn at times. For me, it was about understanding what I needed and opening those lines of communication with my manager so that they were clear with what support I needed in work. More so a flexible working application to support my needs as kind of a parent carer, but also to fulfil my role as a nurse as well. As nurses, we're really good at providing and looking at person-centred holistic care, but actually that doesn't stop with patients. That can be extended to each other. So having that and having, supportive work colleagues and supportive managers is just paramount to a nurse's well-being. As a nurse.
That's a great ending.
Yeah.
Nice. That's a great ending. And I just say thank you to our speakers and for the depth of engagement and enthusiasm and knowledge that was demonstrated. I'm just going to digress a moment because a question came in late for the more formal part. I'm going to read the question out, and it's not so much about the past, it's about the future. So, and I'm going to ask Alex if she'll take this question. So, could you please provide more information around pausing recruitment for the physician associate-assistant course at Swansea and Bangor University in 26-27? There have been a number of PA redundancies in general practice in Wales. The pausing of recruitment and redundancy suggests an intention to scale back the role. There are approximately 200 PAs working in Wales who feel they're in limbo, and graduates who can't find work. Does HCIW have any thoughts on resolution to this except the pausing on recruitment?
Thank you. Tom, obviously, our medical director, has just left the meeting. So I'll take this question. It's a really important question. And I did mention it, obviously, as one of the key risk areas that we were managing last year. So I think the main point at the moment is the Leng review. We were waiting for a long time for the Leng review to resolve some of the issues that have been raised around medical associate practitioners. And obviously, although we've now had the Leng review, obviously there have been issues raised around the Leng review itself, and so we are still in that kind of holding pattern, waiting to understand how we implement that review, but recognising that within it there are some important implications for how we use the role of PAs going forward. So we can't ignore it. It's very important that we give it our full attention and understand the implications of it. And at the moment, that's in a bit of a holding pattern. What we are aware of in Wales is that Welsh Government are going to be setting up an implementation board to oversee this, and they've assured us that the first meeting of that board will be happening in November. So in the meantime, we know that we have a number of students in the training pipeline, and we have a number of students coming out this year, in fact graduating, where there will be very much a difficulty finding roles and employment for those individuals. And so we want to be able to focus all of our effort with our health board colleagues on supporting the individuals who are in that training pipeline to put our best efforts into finding appropriate roles and opportunities for them over this year and the next year, to implement those in line with the Leng Review. And so we felt that it would be unfair to carry on with a university programme being potentially advertised currently with a lot of uncertainty about the Leng Review. And it felt that it was in the best interest, particularly of the PAs in the training pipeline and also our health board colleagues, to just pause, to give us some breathing space, to assimilate what needs to happen as a result of the Leng Review, and then to move forward. Now, that does not mean that we are stopping that profession in Wales. It just means, as I said, we are having a pause to really make sure we can give the people currently in the training pipeline our best attention. We are working really closely with our university colleagues on this to make sure that there is a good flow of information to students on these programmes. And we are very much cognizant of our current PA workforce. And in fact, just during the week, Chief Medical Officer and our Medical Director held a webinar that was open to all MAPs working in Wales, so that they could come along and hear directly from people, ask questions, etc. And I'm sure that will be something that we repeat going forward, and we would encourage people to come forward for those webinars so that we can understand the issues that are going on and they can understand what plans we've got. We've also in HIW invested in an associate dean role, which again I think is a signal that we are investing in supporting the profession and working through the implications of the Leng Review under the guidance of obviously Welsh Government. So it's not just down to HIW to decide on that. It is very much a policy issue that needs to be driven by Welsh Government.
Thank you, Alex.
So we are, we absolutely appreciate the concerns. We spent a lot of time over the last year trying to resolve the issues that were in existence, trying to ensure that we found as many jobs as possible. We actually initiated using our own funding a mental health scheme last year, supported 910 PAs to be appointed in 24-25. Obviously, with the Leng Review, it doesn't look like that's the kind of thing we can do again. So we need to look at different ways of addressing this issue.
Thank you very much. I've had no questions following the showcase. So what people have heard today is not three separate stories, but a continuous journey of how HIW is helping secure the future of NHS workforce. We began with data analytics, which gives us a clearer view through the misty glass, building towards more reliable insights into where our workforce is today and what it could be and where it might be tomorrow. We saw how those insights have been translated into strategic workforce plans, shaping a more sustainable and differently skilled and compassionate workforce. And finally, how do we show real value for the people that are already doing it? And I think that's the thing. How do we have that mark of respect, which is not just well done, but actually how do we develop them? How do we support them to cope with life's journeys? So for me, I think bringing all those three things together has been a bit of a parable for what this organisation is about. It's about joining up an awful lot of dots, and it's about making sure strategically for the future we don't lose sight of all the individual dots, but have got a very clear picture of what we're trying to paint. In other words, we're not impressionists, we are actually developers and influencers. So I'd like to thank our audience for joining us. I hope you have had some value. I know it's been valuable for us in preparing for today. Diolch o galon, diolch o fawr. I hope to see you at next year's AGM, and this year is going to be exciting. Thank you very much.
Well done.